Hello, everyone. This month, my theme is Strengthening Health Systems to Tame Pandemics. On July 13, McKinsey and Company, one of the agencies of the famous global consultancy, issued a report entitled Not the Last Pandemic, Investing Now to Reimagine Public Health Systems. The lesson of the COVID-19 pandemic is that there are basic flaws in the health systems of many of the world's richest countries, countries that boast the most sophisticated medical facilities. Their clinics, hospitals, and equipment are the best and most advanced, and they are staffed by the world's leading experts. But the system which delivers health services has serious weaknesses. As a result, the COVID-19 pandemic has had devastating consequences for some of the world's richest countries. The McKinsey study identifies 5 areas that were crucial for those health systems that were most effective in saving lives in the face of the pandemic. The first feature of the successful response systems is that they are always alert for the emergence of contagious diseases and ready to spring into action at a moment's notice. The contrast is with systems that have to be mobilized afresh for each new event. Health systems in Uganda that had coped with the Ebola virus, or in Hong Kong that had been effective for SARS, were more successful in suppressing surges of COVID-19 infections. A second useful health system characteristic identified is a strengthening of mechanisms to detect infectious diseases at the global, national, and local levels. Health workers in clinics and hospitals around the world should be equipped and trained to identify infections from their early symptoms, and there should be swift and reliable systems of reporting to national and regional centers for disease control and to the World Health Organization. The countries where the incidence of COVID-related deaths are lowest are the ones where the detection, reporting, and coordinating mechanisms were in place and working as soon as the virus was identified. Thirdly, the McKinsey study notes the value of administering existing vaccines more widely, taking special protection measures in areas where there is risk of animal to human transmission and other preventive measures. The report states, quote, recent outbreaks of measles, for example, show that places with lower vaccination rates are more susceptible to diseases that vaccines can prevent. Achieving full global coverage of all the vaccines in our arsenal would save millions of lives in the coming decades. The fourth insight is that the most effective healthcare systems are those that are designed so that personnel, equipment, and facilities can be rapidly provided for a surge in infections without compromising essential health services. These systems have invested in training, equipment, and facilities for epidemic preparedness to enable the creation of temporary care facilities, field hospitals, and the like. Fifthly, there needs to be a large boost to research and development on infectious diseases. Medical research is conducted through global networks of collaboration, as has been demonstrated in the trials being conducted in the search for a COVID-19 vaccine. There are opportunities for all health systems, including our own, to take part in this research. In addition to these health system features, the strength and cohesion of local community and neighborhood organizations is important in supporting effective emergency measures to suppress surges in infections. Media reports have shown the important work of community volunteers in delivering food and necessities to persons at risk and people in self-quarantine. In cities as widely dispersed as Sao Paulo, Brazil, Denver, Colorado, and Wuhan, China. In Cuba, the effectiveness of their community-oriented health system is demonstrated by the healthcare teams seen touring neighborhoods on foot to check the status of everyone in their own homes. This aspect of Cuban health care is unique in a world where health care in the home is mostly unavailable. As our countries beef up health systems to help us to overcome the COVID pandemic, our governments should invest with a view to incorporating all 5 of the desirable features identified by McKinsey and Company. Emergency responses that are always at the ready, early detection systems, measures to reduce the risk of pandemics, standby staff, equipment and facilities, and participation in global trials and research. At the same time, we should all recognize the value of getting to know our neighbors and of participating in and strengthening community networks. They can prove invaluable in an emergency. Thank you and good day.